Well, the critical staffing shortage is being blamed for the closure of the emergency department at the Norfolk General Hospital in Simcoe on Saturday night. The hospital issued a notice on social media around 7:30 p.m. saying the ER would be closed overnight. It did reopen on Sunday morning. Now, the Canadian Red Cross is being sent to Ottawa's Children's Hospital because of an unprecedented number of admissions caused by respiratory illnesses. The move comes as pediatric respiratory illnesses like the flu, RSV, and COVID-19 continue to rise across the province, and that, of course, is putting a strain on the healthcare system. So a small team of Red Cross staff will arrive at the Children's Hospital of Eastern Ontario this week to support patient care. The Red Cross says details of the deployment are still being finalized. Well, Dr. Dina Kulik is joining us now live this morning. She is the pediatrician and founder of Kid Crew. Dr. Kulik, frequent contributor here on CB24 Breakfast. Appreciate your time this morning. So we're hearing that a children's hospital has now had to call in the Red Cross. What does that say to you about the situation in our hospitals?
It is not going okay. Clearly, it's been very, very busy in hospitals. It's been busy in clinics across the province and really across Canada and into the United States. There is so much burden of respiratory virus right now. There is so much influenza, lots of RSV, lots of COVID still circulating, as well as the more typical viruses we see during this time of year, like enterovirus and rhinovirus. And in some cases, kids are getting very, very sick. And in a lot of cases, people don't have access to primary care, and so they're flooding emergency rooms.
And so they're flooding emergency rooms on the one hand. I wonder what it's like in your own practice or clinic, Dr. Kulik. I mean, are you sort of being overwhelmed with calls and, parents trying to get their kids in to see you sort of rather urgently? How do you and your colleagues manage that?
Luckily at Kid Crew where I work, we've been able to accommodate anyone who needs, and in fact are accommodating lots of kids that are not part of our practice because they don't have access, and we're all trying to avoid unnecessary emergency room use. But it has been really an unprecedented viral season and lots of illness for really several months, much deeper into viral season than we are typically at this point in the year.
Now, of course, the one thing that is happening, there's a little bit of relief for some parents in that pain and fever medications are starting to reappear on some shelves. But for some parents, they're kind of past that and they need antibiotics. But even amoxicillin right now is in short supply. Has this situation really now gone kind of from bad to worse?
It is definitely a challenge if we don't have access to antibiotics that we need. However, the vast majority of children right now that are sick don't require antibiotics. They require rest and fluids and things like pain and fever medications, which are being stocked again. The vast majority of illness right now is not bacterial. It does not require amoxicillin, but many kids are being thrown amoxicillin and other antibiotics for their viral infections, which of course don't work. Antibiotics treat bacterial infections, but when we need it, it would be good to have more stock of it so that we can keep kids feeling better and keep them healthy.
So in that case, then, when children actually do need it, then, Dr. Kulik, what is the option? What is the alternative if amoxicillin isn't available or isn't readily available?
Luckily, there are other options. So liquid amoxicillin is a challenge right now, but there are still capsules, there's chewables in many pharmacies. There's other alternative antibiotics that work just as well as amoxicillin. But amoxicillin is tried and true. It tastes yummy. A lot of kids remember, and we remember as kids, that banana-flavored medicine, that's amoxicillin. So it is a go-to for us, but is not the only option at all.
I remember that banana stuff indeed very well, doctor. I'm curious too, as a parent, when your child is sick, you kind of wonder, like, should I go to the doctors now, or is this maybe, ER, is this more serious, or some rest? How do you what's the advice you give to parents in terms of monitoring your children? You don't want to let them get sick, obviously, but you want to sort of figure out when should you be making that call or taking them to the clinic?
For sure. Excellent question. So emergency rooms are meant for emergencies. So if your child is having difficulty breathing, they're losing consciousness, they're not able to drink anything at all, they can't keep anything down, these are reasons to go to the emergency room. But if your child is having a runny nose or a cough or a fever that's lasting less than 4 or 5 days, if they're feeling crummy but they're able to talk to you or communicate with you, they're able to drink a little bit, they're wetting their diapers or having some urination, these are reasons to check in with your doctor or a walk-in clinic or other option to examine your child, make sure your child isn't fighting a bacterial infection. But most of the time, what's afflicting kids right now are viral illnesses. They're going to go away on their own within a couple of days. And I really caution families, if your child is not very, very unwell, again, they're drinking, they're breathing well, they're communicating with you, they're not losing consciousness, that should be a visit with your doctor versus an emergency room visit when possible.
Right. Okay, I appreciate that clarification indeed, doctor. We've been asking viewers to send in some questions as well this morning. Chantel has written in saying, our 5-month-old has had RSV twice. hospitalized for 5 days the second time. Does this indicate future respiratory issues are more likely to occur?
It's a great question. So we do know that for babies that get RSV or other respiratory viruses early, it does increase the risk of future respiratory illnesses leading to wheeze. It doesn't increase the risk of more respiratory viruses. That's just a bad luck thing or an exposure, whether you have older siblings or older cousins or you're in daycare, that sort of setup. But it does increase the risk a little bit of having future wheeze with viruses. And so if your child does have wheeze or is coughing a lot or is having trouble breathing, again, touch base with your healthcare provider. And
Dr. Kulik, if your child gets RSV once, Chantal was just saying, her child has had it twice, is there any sort of immunity built up? Kind of like with COVID, you're sort of, if you get COVID, if you're unfortunate enough to get it, you might get sort of immunity for, 3 months, 6 months, that kind of thing. Is there kind of an immunity buildup with RSV, or can you get it, deal with it, and then get it again quite soon after?
Yes, with any virus, you can get it again. RSV is ubiquitous. 98% of children will be infected with RSV by the age of 2. So everyone gets it. You do get a bit of immunity boost right away, but you could still get it later in the season. Depending how much antibodies your body produces, you can get it again in a month or a few weeks, or maybe not again for another season. It depends on a person's body.
Okay, Dr. Dina Kulik, pediatrician and founder of Kid Crew. Always appreciate the time and insight here. Thanks so much for being here this morning.
You're welcome. Have a great day.